What is a breast augmentation? So breast augmentation is an enhancement of your breast tissue that you already have using an external implant, which is inserted into the breast pocket. There's various shapes, sizes and styles, and it's all dependent on your personal choice and how you want the end result to look like. So when you come for your consultation at Centre for Surgery for breast augmentation, you'll have a chance to speak with your surgeon and go through various different types of breast implant. So what I mean by that is different shapes, different profiles, whether that's anatomical, high profile, round implants, teardrop shapes, whichever shape suits you. You'll also get a really fun chance to try them on. So you can try them on in a bra to see what they look like, the implants themselves. That gives you an idea of how the end result is going to look on you. Obviously, it's not an exact science, it's not exactly how it will look, but it gives you a rough idea of shape and size, and it gives you a chance to kind of really tailor what you want with the surgeon, and so they get a good idea and you get a good idea, and it's helpful for both parties. In your consultation, your surgeon will go through the risks and benefits of different types of implant and different placements, including in front of the muscle, behind the muscle, anatomical placement, high profile, round implants, teardrop implants, everything you've read online essentially. They'll be able to give you the pros and cons and help you to formulate your decision appropriately. So your journey at Centre for Surgery for breast augmentation starts as soon as you've booked in, essentially. Once you've booked your date, you will then have a face-to-face pre-operative assessment with one of our pre-operative team. We'll go through various assessments with you. It can be blood pressure, ECGs, things like that if necessary. We'll also talk you through the requirements of medication, when you need to stop your contraceptive pill, when you need to stop smoking, alcohol, the various frequently asked questions that we get. Once all has been given the green light and all is confirmed, you're good to go essentially. So on the day of your procedure, you'll come through, you'll be greeted by our front of house team who will take you through to our waiting room. Our admissions and recovery nurses will come up and greet you, which is a great chance for you to meet them because they're going to be looking after you. They'll go through your consent forms with you briefly, just make sure that you understand them, and then take some various assessments as well, just to make sure that you're fit for surgery. You'll then be seen by your surgeon who will go through the procedure with you again, go through the consent forms with you, just to fully make sure that you're aware of the procedure and what's going to happen. They'll also just make sure as well that they know what result you want, because it's all about you at the end of the day. You'll then be seen by your anaesthetist who will go through briefly with you the anaesthetics side of things, what they're going to be doing, just to make sure that you fully understand and that you feel comfortable with the whole procedure. After that, you'll be taken through to surgery. The surgery itself is it's a fairly simple surgery in terms of cosmetic procedures. It takes about an hour to 2 hours, depending on the surgeon, and it just involves forming a pocket and the insertion of an implant based on the one that you decided on. Afterwards, you'll come through to recovery. You usually wake up about 30 minutes after the procedure. It takes you a little bit of time to come around, and after that, you're pretty much awake and feeling ready to go. Pain tends to be manageable. You don't tend to wake up in acute pain, and your nurses around you will be there to provide you pain relief should you need it. You've got a whole team there who will be there supporting you from start to finish. Once you're safe to go home, you'll be sent home with your chaperone, who will take good care of you and will give you a call the next day. Our nurse team like to call you on day 1, day 3 and day 5 just to check in, make sure that you're doing fine, and we like to see you 5 to 7 days after the procedure to check on incisions and to check on you as well, and make sure that you're healing properly and check that you're feeling all right after a procedure like this. We understand any procedure that you make is a personal choice to you, so it's important that you feel supported amongst the whole journey, and so that's what we're there for. Any problem, any worry, you give us a call and we're there to help you. Centre for Surgery prides itself on being patient-centred, and what I mean by this is we're not a company that is pushing patients through the door. It's not sales-focused, it's results-focused for you, based on our patients, for our patients. This is something that sets us apart from many of our other competitors on the market, and it's something that you'll notice as soon as you walk through the door of Centre for Surgery, essentially. It's a warm environment, it's a happy environment, but it's a medical environment and it's a clinical environment, and it's there to keep you safe. From my experience, I've seen so many happy patients in and out of these doors with results that they've wanted for years, for many years, and they've been achieved, and it's changed their lives profoundly. So all I can say is we really can't wait to have you here. We're looking forward to seeing you, and we're looking forward to your journey as well, and to helping you achieve what you want to achieve.